people's right to exist, grieve, and to heal, with the right of the Israeli state to visit atrocities and trauma upon the Palestinian people. The situation for healthcare workers and everyday people in Gaza is beyond dire. The Israeli state has utilized the October 7th attacks by Hamas as an opportunity to carry out a brutal and sustained assault on Palestinian lives, killing over 11,000 people in Gaza so far, while soldiers and settlers in the West Bank have unleashed a surge of violence on Palestinian communities, killing over 200 and counting. The voices of Israelis who have dared to challenge this unfolding genocide have been harshly suppressed by the Israeli state, as Gaza Strip hospitals, medical facilities, emergency vehicles, and medical personnel have been systematically targeted with bombing, shelling, and sniper guns. The WHO has condemned attacks on at least 137 healthcare sites in Gaza as of November 12th. Facilities for crucial mental health programs and vital social services have been gutted by bombing, while countless Gazans are suffering from deep psychological trauma. The Israeli state's 18-year blockade on Gaza has been escalated to the level of a total siege, which has severed the region's access to food, fuel, electricity, water, and medical supplies. Due to this imposed lack of resources, hospital workers have been forced to close facilities, turn away patients, perform surgeries without anesthesia, and watch newborn babies requiring life support take their final breaths. In bringing Hamilton healthcare workers together here today, we hope to inspire the formation of sustained networks dedicated to further collective action so that we can join with healthcare workers across the globe in organizing to push our governments, our employers, our professional associations, our unions, and our governing bodies to call for a ceasefire in Gaza, to call for an end to the deadly siege on the region, and to challenge the Israeli settler colonial state's occupation of Palestine. We certainly will not be alone. On Turtle Island, the Canadian Federation of Nurses Unions has joined Doctors Without Borders in demanding an immediate ceasefire and a lift to the blockade of vital medical and humanitarian supplies. Shortly after the military offensive on Gaza began, the Palestinian Union of Social Workers and Psychologists made a call for all social workers, mental health workers, and advocates for freedom at large to stand against the current invasion, as well as the ongoing crimes of occupation, apartheid, and colonial violence faced by Palestinians for over 75 years. We invite all healthcare workers in Hamilton to join the global cry for a free Gaza and a free Palestine. Cease fire now! Cease fire now!